Specialty contact lenses range from soft lenses that are for higher or unique prescriptions to more rigid, small lenses that are meant for things like corneal scarring or lots of astigmatism. My primary focus is what's called a scleral lens. A scleral lens is a very large, hard lens that sits on the sclera, which is the white part of the eye. And it's unique because it sits on that white part that is not sensitive, so it feels just as comfortable as maybe more comfortable than a soft lens would be, but it helps to vault over problems that the person may have that might prevent them from wearing their typical glasses or conventional contact lenses that you would think of. How specialty lenses differ from normal conventional lenses is various things. It's the shape, it's the material. All of our commercially made lenses are just very generic sizes and prescriptions. So with specialty lenses, it's more like getting a retainer made for your teeth. It's specifically formed to your specific eye. No one else can wear the same lens. But we also have those patients come in so we can make adjustments and modifications to those lenses to help get them the best vision possible. Yeah, specialty lenses, especially scleral lenses, are great for vaulting over problems, and that could be problems such as irregularities that patients are born with, such as keratoconus. It could be scarring from previous surgeries or previous injuries a person may have. It could even be something as benign as dry eyes, where the patients are intolerant of how their eyes feel, especially when trying to wear conventional lenses. And those lenses that are scleral are able to help keep moisture on the surface of the eye and prevent those symptoms and help those patients see more clearly. Probably one of the bigger hurdles of them is oftentimes they're medically necessary, and that's more of an insurance term to say, hey, other conventional forms of vision correction can't help this person, so we need the insurance to help out with this problem. But anybody can do them, can wear them. They can be for just your typical prescription, nearsighted, farsighted astigmatism, normal, mild dry eyes, even people who need just help reading. You can have bifocal or multifocal contact lenses as well that can alleviate some of the need for the over-the-counter readers. For a specialty lens fitting, what we do initially to see the patient is get all their baseline information, check their vision, try to learn about their history, take a look at their eyes, and then we take detailed corneal maps, sometimes of just the surface, sometimes of all the layers of the cornea to get specific measurements. And then we will apply a test or a diagnostic lens to that person's eye, assess the fit of that. We can take measurements of that with some of our equipment to see what kind of changes we need to make. And then we perform what we call an over-refraction, which is dialing in additional prescription we need to add into that lens to help that person be able to see through that lens without the aid of glasses in addition.